Hello and welcome to our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here I am today with our guest, and our guest today is Indra Lucero. And we're going to talk about their upcoming presentation here at Gold about human rights during birth, healthcare providers as human rights defenders. It's my great pleasure to have you here, Indra.
Pleasure to be here.
Oh, lovely to have you here today, speaking about such an important topic. And as a midwife, I have to tell you, and I think I said this before, this is a topic near and dear to my heart. So I'm really looking forward to this presentation and learning more what I, as a healthcare provider, can also contribute and do. But before we jump into that area and your presentation, tell us a little bit about yourself. Number one, where in the world are you located? We have an international audience here, so it's always fun to know where our speakers are. And then tell us a little bit about your background.
Yes, I'm here in the Rocky Mountain region of the United States, in the state of Colorado, um, in the metro area of Denver. And I actually was already what I would consider a reproductive justice activist when I decided to go to law school. And I decided to go to law school specifically with the vision of working on legal issues related to childbirth. So this has been my focus ever since I started law school.
Absolutely fantastic. That is what I call really dedication. You knew already what the focus of your why you're doing this, and having that dedication right there from the start, from the beginning. So tell us, you are the founder of Elephant Circles. Tell us a little bit about that too.
Yes, partly because when I had that vision, there weren't really any jobs you could do with that focus. So I knew that I'd also have to create the pathway to do the work. I also have since founded the Birthrights Bar Association as another pathway, really to help build the capacity of lawyers and legal advocates who also want to specialize in this area. And Elephant Circle is a birth justice organization, so it works very intersectionally on all kinds of issues in the perinatal period, which we include preconception through at least 2 years postpartum.
Mm.
And if I may add, actually, we're called Elephant Circle because we're inspired by how elephants birth in the wild. The whole herd circles around, stays with the laboring elephant for the duration of labor, lending support and nurturance. They're connected to the process, but they're also forming a powerful circle of protection and defense. And that's what we envision for everyone. Everyone needs that kind of circle of support in the perinatal period.
Absolutely wonderful. I was just wanting to ask that, about the name. I knew there was something behind, must have been something behind that, name. And you're giving us such a powerful vision there. That's absolutely beautiful. Thank you so much. Another thing I know about you is something that I am it's very impressive that you were involved in this for me is that you helped pass legislation in Colorado to eliminate the shackling of incarcerated women during pregnancy and birth. And when I first found out about these practices that there were still going on in the United States, I was absolutely shocked and uh, and then I kept thinking, why don't we know more about this? Why don't we hear more about this? This is horrendous. We know about women giving birth alone in their cells, without unassisted, without help, scared, in dangerous situations too. By themselves. There, no emotional support. I can only imagine how awfully traumatizing that must be for women in these situations. So, if you want to speak to that as well about the legislation, just briefly, I would like to find out more.
Exactly. I mean, that's a great example of a violation of human rights. And unfortunately, even though we passed that law 11 years ago,
Mhm.
just 2 years ago here in Colorado, somebody did give birth alone in a jail cell. So we actually are bringing new legislation this session to require some basic standards of care for people who are pregnant and incarcerated. Um, because currently what happens is people are not only neglected, but experiencing extreme violations of human rights.
Mhm.
We actually just had a hearing on this week, and we had someone testify about their experience. They were falsely accused of a crime, put in jail while they were breastfeeding, and not given a breast pump even after they asked. And of
Wow.
course,
Wow.
that has all kinds of consequences, physical consequences, psychological consequences, consequences to her family, not just the kiddo who was breastfeeding,
Mhm.
but the other kids. Um, so in 2010, which actually I was still in law school at that time, I had learned about Colorado's practice of shackling incarcerated people while they were in labor. Just horrific.
Horrific. It's terrible.
So we did pass a law prohibiting that practice, but I've heard that from providers who provide care for folks
Mhm.
that they would still arrive shackled, they would still be shackled at the hospital. So we knew there needed to be some more accountability. So that's one of the things we've written into the bill this year. Um, and that's something I'll talk about a little in this talk, is that just having the rights doesn't, of course, ensure them.
Mm.
So you always have to follow up and keep an eye on things and advocate.
Advocate. Yeah, that's a really good point. Yeah, just because these laws exist doesn't mean they're enforced. That's absolutely true. Another wonderful thing you did, you created this resource called Birthrights, a resource for everyday people to defend human rights during labor and birth. I have downloaded that resource myself, and I will distribute it. I also have some midwifery students and doulas that I know. Definitely hand that out as well. Talk about this. This is just such an amazing resource you make available for free there out there for download.
Yes, it's the culmination of many years of work, probably all the learning that I've done since I got into this field. And
Hmm.
it's based on the kinds of conversations I would have with people, um, people who were facing human rights violations in the moment, and also people like midwives and doulas, people who were providers in some capacity or family members who witnessed these violations and wanted to know what to do. Number one, people always want to know, well, what is the law? What are my
Mm,
rights?
right.
And then number two, what can I do? And so essentially, this resource tries to do that in a really accessible way that people can use in the moment. So you can dive into a page and kind of get some grounding in your initial questions, and then it allows you to dig deeper and read more. We have extensive notes in the back for people who get really interested. But there's also good visuals if you just need a concept visually conveyed. And I'll actually share some of those images in my presentation as well.
Oh, wonderful. And that's a wonderful segue to your to the next question I had for you. Just to give a little overview about your presentation, human rights during birth, healthcare providers as human rights defenders. So let us know. Give us just a brief overview here.
Well, I definitely want to be clear. It's human rights during birth and lactation.
During birth and
Um,
lactations. Yes, absolutely. Thank you for clarifying that.
and
Yes.
specifically how providers can see themselves as human rights defenders. A lot of times, in my experience, providers too feel sort of at the effect of other systems
Hmm.
and feel like the rights are something out there that other people are experts in and that other people need to do something about. Um, and I want to help bridge that gap. So that's one of the things that this presentation does, is just
Hmm.
show folks how they can go from where they stand in relationship to human rights and see themselves as an advocate, see some
Hmm.
pathways for how they can take whatever power they have. And of course, they don't have to have all the power, but just
Hmm.
any little bit of power can make a difference in somebody's life, can help prevent a human rights violation.
Hmm.
So I I provide some context and then also some glimpses into human rights documents, some tools, some strategies folks can use. And then we talk a little bit too about accountability
Hmm.
and really some of the barriers to defending human rights so that folks can anticipate. what kinds of barriers they might run into.
Yeah, sounds like you're really breaking it down in good, easy to understand chunks and ways to for us to really look into that and feel empowered, and also for all the families we serve to advocate for them, and because it can be daunting, right? It seems like, as you mentioned, it could be. We're seeing it often as healthcare providers. Doesn't matter if you work in the field of lactation, and even doulas, we see something that the law, that's something others do, and it's intimidating because we're not the experts in this. So having information on what we can do, and to resources that point us in the right direction, will be extremely helpful.
I hope so.
Well, Indra, thank you so much for sitting down here with me and chatting about the amazing work you do out there in the communities, and the services you provide, and also about the presentation here at Gold.
My pleasure. Thanks for having me.
Thank you so much again. And for our viewers, this presentation is part of the brand new lecture pack titled Ethics for Lactation Professionals. And if you want to find out more about this particular presentation and the other presentations in the lecture pack, we invite you to go to goldlearning.com to find out more. Thank you again, Indra, for being here with me today. And thank you to all our viewers. Bye bye, everyone.